Hi everyone. Today I am giving you information on the topic rheumatoid arthritis, which is the part 3, in which I'll explain you about the different stages of the arthritis. So let's move to the 4 stages. First stage is the early stage, second stage is the moderate stage, third one is the severe, and the fourth one is the end stage. So let's discuss one by one. First stage. In first stage, joint pain or the swelling takes place. Inflammation inside the joints. Okay. So joints are present in between the two bones and the inflammation or the swelling takes place between the two bones. Tissue gets swell up. The tissues with present between the two bones get swell up, due to which a pain we will feel. Synovium, which is a joint lining, it gets inflamed. Okay. So inflammation takes place of these joints in the first stage. Next one is the stage 2. Synovium's inflammation cause damage to the joint cartilage. Okay, so we have seen that synovial is a membrane. Due to the inflammation of synovial membrane or the synovial membrane, the joint cartilage, it cause damage to the joint cartilage. Joint cartilage gets damaged due to the inflammation of the synovial membrane, because these are connected to one another. When the cartilage is damaged, the people may experience pain and loss of mobility. Okay, so when the cartilage get damaged, which is present there. Okay, so here is the cartilage I am showing you. This one is the cartilage is present here. Okay, here the cartilage is present. So when effects takes place to the cartilage, then the people will experience pain. They have a pain and loss of mobility. Loss of mobility means they are not be able to move their joint. Okay, movability is limited. Okay, for example, we can move our arm at the 180 degree. Okay, so it will be experienced that it will move to only 160 degree, not to 180 degree. Okay, so mobility loss is there, and range of motion may be limited. So motion range is limited, because when we are able to move it 180 degree, now we are able to move it on to 160 degree only. Next one is the third stage. Damage extend not only to the cartilage but also to the bones themselves. Now it is affecting the areas. Okay, now it get moves to the bones itself. Cushion between the bones is borne away. They will rub together. Okay, so synovial fluid gets affected, synovial membrane gets affected, cartilage get affected, and in between the two bones, wear and tear takes place. They will get worn away when we are able to move the joints. When we will move the joints, okay, so wear and tear takes place in between the both joints, because they are not be able to move due to the lubricates or grease is not present there. More pain as well as swelling as compared to the second stage as well as the first stage. Muscle weakness and more mobility loss. Okay, now in this case we are not be able to move it on to the 100 degrees. Okay, more mobility loss is there, muscle weakness is there. Bone damage and erosion and some deformity can occur. Bone damage or bone erosion means bone starts crushing into the small pieces, and some deformity can occur. You can notice that there is a shape changes takes place in the bone in case of stage 3. Next one is the end stage, which is the fourth stage. No longer inflammation of the joint. Now here the inflammation get removed. There is no swelling inside the joint. There is no longer work of the joint. Okay, the which you can move it to the different degrees, it will stop working. Okay, more pain, more swelling, more mobility loss is there. You are not be able to move that joint where it gets takes place. Bone fuse together and results in ankylosis. Okay, so two bones get joined together here. Okay, two bones get joined together here, and you are not be able to move them at any degree. It gets stop moving and you are not be able to move them. This is the bony ankylosis. So bones get fused together and results in ankylosis. Next one is signs and symptoms. Now what are the signs and symptoms? Tender, which is the roundness, and the nodule forms at the joint. Different nodules, circular nodules are formed at the joint. Warm and the swollen joints. Okay, joint stiffness is usually worse in the morning and after inactivity. Joint gets stiff and they are worse in the morning after inactivity, because at the night we will sleep at the 8 hours or 7 hours, and the joint movability is lesser in the morning. As you grown up, as you do more work, then joints starts moving, but in case of morning they will not be able to move. Fatigue, fever, and the loss of appetite takes place. Nodules form on the elbow and rarely on the lungs or hearts, but it can also affect the different parts of the body. Okay. Next one is, what is the treatment? NSAIDs and steroids reduce inflammation. NSAIDs means non-steroidal anti-inflammatory drugs are given to the patient, as well as the steroids are given to the patient. So those two steroids affect the different parts of the body, okay, but these are very important, otherwise this will move to the end stage. DMARDs, disease modifying anti-rheumatic drugs, help to save the joint tissue by slowing the increase of RA progression, by suppressing our body immune system and the inflammatory responses. Okay, so disease modifying anti-rheumatic drugs are given to the patient so that it will save the joints, but it also affects the immune system of the body. Okay, so immunity of a patient gets weak by taking these kinds of drugs, but it can save the joint, so it is very important to take it. Surgery may be an option. In which joint this ankylosis takes place, or you can say that something wrong is going there, so surgery may be an option at the end stage. Remove the synovium or the nodules. If the nodule forms inside the body, then it is important to remove it. Fuse joints together or replace joints. Okay, so fused joints, those joints which get fused together, we can replace them. Exercise that doesn't put too much pressure on the joint can improve the muscle strength. Exercise needs to be done which only improves the muscle strength and which does not put a pressure on the joint. It will not increase the our problem, but it can solve the problem by improving the muscle strength. So exercise may be an option, maybe a treatment, so that our joints will properly move. Next one is stop smoking. If you are doing smoking, then stop it. Next one, diagnosis. How to diagnose it? First one is the blood test. Blood test is done because 80% of it is rheumatoid factor is present inside the blood. Next one is imaging, X-ray. Okay, inside the X-ray you can identify that what is the shape of the bone, at which stage the bone is going on. Next one is the bone density. Bone density test is there, that what is the density of the bone, how weak the bone is or how strong the bone is. Soft and the tissue swelling. Okay, narrowing of a joint space. There is a space present between the two joints, so narrowing of a joint place get understood by doing the X-ray. Next one is the bony erosions. Any erosions takes place inside the bones which get also diagnosed by the X-ray test. So this was the diagnosis. Thanks for your patience listening.